Hi, my name is Heather Fight, and I am an occupational therapist who's been treating within the pediatric realm for approximately 9 years. Today's topic is regarding CATS, critically appraised topics about play, yoga, and art as interventions for children with anxiety. Anxiety within pediatrics is the most common psychiatric condition amongst this demographic. The mean age of receiving a diagnosis of anxiety being 6 years of age, with approximately 32% lifetime occurrence. Anxiety influences their overall ability to successfully participate in activities that require their full mental faculties, such as school related work, peer engagement activities, and activities of daily living, such as getting dressed, eating, and even sleeping. The purpose of this review was to identify if play, yoga, and art are effective sensory motor based interventions to help children manage the effects of their anxiety. There were 5 steps to completing each CAT. The first step was identifying the keywords and phrases. This was different for each one. The step 2 was to identify search engines that were going to be utilized. This was the same. I utilized Child Development and Adolescent Studies, SINHAL, PsycInfo, and PubMed. The third step was to collect articles that met the inclusion criteria. The fourth was to keep relevant articles that answered the focus questions. And the fifth was to analyze the research articles to answer the focus question. The first one that I completed was play. The keywords that I utilized were play therapy or therapeutic play or child-centered play therapy, and anxiety disorders, anxiety or generalized anxiety disorder, and children or adolescents or youth or child or teenager. I found 205 articles regarding play. Those that answered the focus question of what is the evidence for utilizing play to help manage the effects of the child's anxiety was 20. 20 articles met the criteria for the review and provided evidence for the utilization of play as an intervention for children with anxiety. There were varying levels of significance ranging from none to a large impact. The bottom line of these articles identified that play was beneficial amongst children ages 3 to 15. Play can also help children learn age appropriate play skills, conceptualize and work through different scenarios, gain increased understanding, and develop successful coping strategies with regards to their anxiety. The next one that I completed was yoga. And the keyword and phrases I utilized were yoga or yoga therapy or yoga exercise, and anxiety disorders or anxiety or generalized anxiety disorders, and children or adolescents or youth or child or teenager. There were 168 articles that met this criteria. To answer the focus question of what is the evidence for utilizing yoga to help manage the effects of anxiety in children, 20 were considered relevant. There were also varying levels of significance were found ranging from none to large, as well as one inconclusive study. The bottom line for utilizing yoga as an intervention identified that children ages 3 to 21, yoga was effective. Yoga can help a child manage and cope with the effects anxiety has on their lives, improve their mental health and well-being, and increase their overall well-being. Art was the final one that I completed. And the keywords and phrases were creative expression or writing or drawing or art therapy, and anxiety, anxiety disorders or generalized anxiety disorder, and children or adolescents or youth or child or teenager. This produced 612 articles. The focus question was, what is the evidence for utilizing art to help manage the effects of anxiety within children? This left me with 12 articles. Varying levels of significance were found, ranging from small to large. The bottom line for utilizing art is that it is useful for children ages 2 to 21. Art is found to be effective across all different contexts and children experiencing different types of anxiety. Art-based interventions can help children process, conceptualize, and express their feelings in a safe manner and have an outlet for their anxiety. So what's next? with regards to this information and occupational therapy? Well, occupational therapists use sensory motor based interventions with their children. And since pediatric occupational therapists work with children ages 0 to 21 years of age, if not older, using these sensory motor based interventions to help manage and help teach children how to manage and cope with the effects of their anxiety is very relevant, especially because we want to be able to help these children live their lives to their fullest potential. And if their anxiety is influencing this, we need to be able to help them. We can use play, yoga, and art within our structured interventions, as well as teaching and educating parents how to help their child use these interventions and encouraging these children to use these interventions even independently throughout their daily routines. We can also encourage and teach our teachers and educators on how to use these interventions with children that they are seeing within their classroom settings who have anxiety. These forms of sensory motor based interventions can be utilized within many different contexts: schools, outpatient clinics, even within the hospital setting. So go ahead and try it. It might just help your child.